My name is Dr. Eric Dougherty. I'm the owner of the Cat Practice, and I'm located in Manhattan, New York, and we have been open since 1972, so one of the oldest cat practices in the United States. The most common cat ailments that you'll probably run into would most likely be something like kidney disease or hyperthyroidism. They're both usually pretty common in older cats, not so much younger cats, but that also depends on the signalment of your animal. So for example, if you have a younger cat, you're going to be predisposed to certain things, just like an indoor cat versus an outdoor cat. But most of the time, when you have an older cat or you have any cat in general, at some point they will probably have either a thyroid or kidney issue as one of the bigger things in their life. For the development of chronic kidney disease, okay, and there are two different types of kidney disease. There is acute and there is chronic. So acute would be something like your cat eats lilies, or your cat for whatever reason gets into antifreeze or something along those lines. That would be an injury that we can fix sometimes, but that would be more acute in nature. The chronic kidney disease cats, the older cats that we tend to see this in, unfortunately, there is still kind of a big mystery as to why a lot of those cats do develop kidney disease in the first place. If you have a cat and you are concerned that your cat may be showing signs of kidney disease, those signs are usually pretty easy to spot. The big signs for a cat that is developing kidney disease would be a cat is peeing and drinking a lot more than you're used to seeing, probably losing a little bit of weight, and also the appetite is probably a little on the picky side. Sometimes it can be hard because increased peeing and increased drinking can be due to diabetes, can be due to hyperthyroidism, can be due to high calcium. So we really want to try and narrow down where those behaviors are coming from. If you suspect that your cat has got kidney disease, the best thing to do is bring them into a veterinarian, and a very simple blood test can say yes or no as far as whether your cat has any kidney disease whatsoever. Changes in kidney function are going to show up in urine before they show up in blood work. So what we always recommend is trying to drop off a urine sample, or preferably have your vet get one directly in the office, because you will be able to get a true picture of kidney function by getting both blood and urine. Now, phosphorus is very important because as phosphorus gets higher in the body, it will cause certain endocrine changes, in particular your parathyroid hormone, which is very important for maintaining calcium and phosphorus homeostasis in the body. The higher your phosphorus gets, the more that will affect that hormone, and it will cause certain other changes that we really don't want to see. So measuring your phosphorus is actually not difficult. We just do a very simple blood test, and we can get a numerical value that will give us a normal reference range. And hopefully your cat will be in that reference range. Kidney disease goes in different stages, so stage 1 being the earliest, stage 4 being the latest. And a lot of times, if your cat has early kidney disease, we simply just recommend a diet change and not much other treatment. And we basically monitor your cat until we feel as if the kidney values are high enough to warrant an additional treatment at some point. Diet would have something to do with kidney disease because we do recommend that you feed your cat as much of a wet food diet as possible. Dry food really tends to dehydrate most cats, and it does cause them to produce less urine, so less urine volume, and it does predispose them to things like stones, which of course, if you develop stones, that can absolutely cause kidney disease. Cats as a species, they are what's called obligate carnivores. The only thing that cats need is protein and a little bit of fat. They have no use for vegetables, and they have very little use for carbohydrates. So one of the things you want to do is always try to feed your cat an all-wet diet, because that will allow them to get a better protein source. It will be less processed, because in order to make that dry food into these nice little nuggets, it has to be made in a much different way than just preparing wet protein. So overall, the best thing you can ever do, no matter what, is really try to do wet food over dry food. That is the most important thing you can do when it comes to feline nutrition. One of the ways that you can reduce phosphorus, okay, just from either a pet food company or if you're making your own food at home, is you can actually try and find protein sources that are going to be a little bit lower in phosphorus than others. So for example, if you look at a manufacturer's label and you see a diet that says ocean whitefish and gravy and one says tilapia and gravy, they may be seafood diets in gravy, but they may not have the exact same nutritional value. So you would try and find a protein source that has lower residual phosphorus in it to begin with. So if you don't want to use an animal protein, you can find a different protein source like an egg white or something like that, which is still a very good protein source, but does not have nearly as much phosphorus as, let's say, a piece of fish or a piece of meat. Dry food, consider it as like a concentrated form of a meal. Okay, so dry food on average will have about 3 to 5 times the number of calories as the same volume of wet food. And it's very similar too with some of the other nutrients in there, and phosphorus would be one of them. In order to make dry food, it has to be processed, and some companies will use like a certain type of phosphorus salt or a preservative, something like that, in order to make the product as, palatable but also as long-lasting as possible. So dry food tends to contain much higher levels of phosphorus simply because of the way that it's made, and also just because of the inherent quality of the food itself.